Some tumors at the neck or head respond very well to radiation therapy. Yet there are some drawbacks too. If the tumor moves away from the radiation radius due to weight changes in the patient, for example, healthy tissue enters the range and can become damaged. In the SPARTA project, supported by the Federal Ministry of Education and Research, scientists at the Fraunhofer Institute for Medical Image Computing are now developing software that assists in continuously adapting irradiation during therapy. What challenges are radiotherapists facing, and how can the new software help them?
Eine Strahlentherapie beruht stets auf einer aufwendigen.
Radiation therapy is always based on an intricate patient-centered plan. Here, the therapist needs to first contour the target structures, typically the tumor, as well as all of the organs considered at risk inside the radiation field. A treatment planning system can subsequently calculate radiation therapy based on this contouring. This contouring consists of up to 1,000 contours and outlines that are drawn on hundreds of CT slices, making this entire planning process very complex for radiotherapists and totals between 4 to 6 hours. The result is a plan that's delivered to the patient over a 6-week period. However, the body goes through physiological changes during this treatment, for instance because of tumor shrinkage or a patient's weight loss. This is where adaptive radiotherapy comes in, where we try to already improve the overall course of treatment during therapy by adapting the initial plan. To adapt the planned treatment, a new CT is generated during the course of the therapy. In the simplest case, all contours of the treatment planning image would need to be transferred to the new image to detect physiological changes, which in turn means that you would have to produce another treatment plan. Added to this is a very tight time frame because the patient starts to feel discomfort during the course of treatment, for example, which in turn requires quick action. You therefore have 1 day at most to implement this and produce an adapted plan.
Etwa weil der Patient im Verlauf der Therapie Beschwerden entwickelt, die dann ein schnelles Handeln erfordern. Es muss also maximal mit einem Tag Verzug reagiert werden und eine angepasste Planung erzeugt werden.
How can this software help radiotherapists?
Bei Fraunhofer MEVIS haben wir eine prototypische Software namens Qt.
We have developed a software prototype called Qt at the Fraunhofer MEVIS, which is intended to assist the radiotherapist with this specific planning adjustment process. The software calculates a non-linear registration between the control image and the initial planning CT scan. That means the structures are precisely mapped for both points in time. With this registration, the initial contours are subsequently transferred fully automatically so that the radiotherapist is able to focus on his or her actual skill. He can virtually review the prepared plan and adapt it if necessary. We have conducted first evaluations in collaboration with our clinical partner LMU Munich. These show that the results keep up very well with the quality of standard commercial solutions, but offer enormous time savings compared to the manual method contouring, which can typically take from 90 minutes to 2 hours. Our software achieved this in half an hour and includes a thorough check of the structures.
Wurden mit unserer Software Ergebnisse im Bereich einer halben Stunde inklusive einer vollständigen Überprüfung der Strukturen erreicht.
The results speak for themselves. How complicated is it to integrate this new technology into existing systems?
Die Software läuft auf einem
The software runs on a commercial PC, typically on Windows. It can run from a USB stick and import image data in standardized DICOM RT format. That means the user can import data from a CD, for instance, but can also import it from a clinical image database, a PACS archive. The results generated with our software can also be exported again in DICOM RT format so that they can subsequently be used with standard commercial software. The software already undergoes a prototype evaluation during its runtime. That means individual clinicians use the software for retrospective analyses. The project consortium also includes industry partners, and we're in conversation with them already. After project completion, we will subsequently also transfer portions of the results into commercial systems.